Health effects of vitamin D. Thank you for joining me today. We're going to spend the next hour talking about something that may seem small but has a huge impact on our health. Vitamin D. Now, most of us have heard vitamin D called the sunshine vitamin. But what happens when we don't get enough of it? That's what today is about, the health effects of vitamin D deficiency. By the end of this session, you'll understand what vitamin D does in the body, the health risks of not having enough, the signs and symptoms to watch out for, and practical steps you can take to maintain healthy vitamin D levels. Understanding vitamin D. What is vitamin D? Fat-soluble vitamin. Two main forms, D2, ergocalciferol, from plants, and D3, cholecalciferol, from sunlight and animal products. Unlike most vitamins, the body can produce vitamin D when the skin is exposed to sunlight. Role in the body: regulates calcium and phosphorus absorption, maintains healthy bones and teeth, supports immune, brain, and nervous system health, play a role in muscle function, mood regulation, and reducing inflammation. Interactive pause. Quick show of hands. How many of you spend at least 20 minutes outside in the sun daily without sunscreen? Not many, right? That's already one reason vitamin D deficiency is so common. Causes of vitamin D deficiency: limited sun exposure, indoor lifestyles, winter seasons, sunscreen use, covering clothing. Darker skin pigmentation, melanin reduces vitamin D production. Age, older adults have reduced skin capacity to produce vitamin D. Obesity, vitamin D is fat-soluble and gets stored in fat cells, making it less available. Medical conditions, kidney disease, liver disease, Crohn's, celiac, etc. Dietary insufficiency, vegan diets, low intake of fatty fish, fortified foods, or supplements. Health effects of vitamin D deficiency. 1. Bone and skeletal health. Children: rickets, soft bones, bowed legs, stunted growth. Adults: osteomalacia, bone pain, muscle weakness. Seniors: osteoporosis, fragile bones, increased fracture risk. Illustration: imagine a house built with weak cement. That's what your skeleton becomes without vitamin D. The foundation weakens. 2. Immune system. Vitamin D activates immune cells. Deficiency linked to higher risk of infections, colds, flu, respiratory infections. Recent studies connect low vitamin D with increased COVID-19 severity. 3. Mental health. Vitamin D receptors in the brain affect mood-regulating chemicals like serotonin. Low vitamin D linked to depression, seasonal affective disorder, SAD, anxiety. Some studies show supplementation can improve mood. Muscle function and physical health. Weak muscles, frequent fatigue, higher risk of falls in older adults. Athletes with deficiency, reduced performance, longer recovery time. 5. Chronic diseases. Cardiovascular health. Low vitamin D linked with hypertension, heart disease. Diabetes may impair insulin sensitivity. Cancer. Some studies suggest low vitamin D increases the risk of breast, prostate, and colon cancers. Autoimmune diseases. Higher risk of multiple sclerosis, rheumatoid arthritis, lupus. 6. Pregnancy in infants. Deficiency in mothers. Gestational diabetes, preeclampsia, premature birth. Infants, rickets, delayed growth, seizures due to low calcium. How many of you recognize at least one symptom you've felt before, like constant tiredness, bone pain, or low mood? That might be your body whispering about vitamin D. Signs and symptoms of deficiency: fatigue, low energy, frequent infections, bone and back pain, muscle weakness or cramps, low mood or depression, slow wound healing. Hair loss. The tricky part is these symptoms are vague. They can be mistaken for stress, aging, or lifestyle issues. That's why testing is important. Prevention. Sunlight exposure. 10-30 minutes 2 to 3 times per week, depends on skin tone, season, location. Dietary sources: fatty fish, salmon, mackerel, sardines, egg yolks, liver, fortified dairy plant milks, fortified cereals. Supplements: vitamin D3 is preferred. Dosage depends on age, weight, and health status. Typically 600-2,000 IU daily, but check with a doctor. Testing. Simple blood test, 25-hydroxy-vitamin D. Lifestyle adjustments. Balance sun safety with vitamin needs, outdoor activities, diet planning. Vitamin D deficiency is often silent, but the health consequences are anything but. From weak bones to weakened immunity, from depression to chronic diseases, the lack of this single vitamin can affect almost every system in the body. The good news? It's preventable and treatable. Small changes, like a walk in the sun, eating vitamin D-rich foods, or a daily supplement, can make a huge difference in your long-term health. So, I encourage each of you, after today, pay attention to your vitamin D. Talk to your doctor, check your levels, and take action. Your body will thank you for it.